Good morning, everybody. In late breaking news last night, Novo Nordisk, the company behind the drugs we know as Ozempic and Wegovy, as well as the inventors of those drugs, semaglutide, is asking the FDA to crack down on compounded semaglutide, citing safety risks. If they succeed, patients like you and I, relying on these affordable alternatives, could find themselves without options. Good morning. I'm Christopher Durham, live from Phoenix, Arizona, where Lorraine and I are putting on a conference for our full-time jobs, but I wanted to pop on and talk about the news today. So before we get any deeper, I want to make something clear. I'm not a doctor, a lawyer, a pharmacist. I'm just a dad. Lorraine and I are just a couple who found GLP-1s, and we're evangelizing out there for them, started a YouTube channel. So everything I share here is based on my experience and research, but always, always, always consult your healthcare provider before making any decisions about your medications or your healthcare. So this is complicated stuff, and your health deserves professional advice. So more than Facebook, more than YouTube, make sure you go see a doctor. Now, for those of you who are new here, welcome to Downsized. I've been on my GLP-1 adventure since September 23rd of 2020 of last year and lost 80 pounds. My wife Lorraine and I has dropped 50 pounds. She's dropped 50 pounds, and together we've lost 130 pounds using compounded tirzepatide, Mounjaro, and Zepbound. These medications have changed our lives. And although we've never taken semaglutide, we certainly endorse it as a great medication, and it's something that we would consider if we could not get the tirzepatide that we've been taking. So absolutely. Hello, everybody out there. We're doing the news this morning. Michael Clanton, Billy Parrish, let's see, Thin From Within 66. Thanks for being a member, Thin From Within 66. So if you find this content helpful, please hit the like button, subscribe, tap that bell so you make sure you never miss an update. Good morning, Jazzy. Late last night, our friend and fellow YouTuber Dave Knapp broke this Novo Nordisk story. Dave's doing a great job over there. Make sure to check out our conversation we had with Dave a few weeks ago. If you haven't already, it's a great conversation. So thanks, Dave, for all you do as well. But we wanted to give you our perspective. So here's what's happening now. Novo Nordisk has formally requested the FDA to put compounded semaglutide on the Demonstrable Difficulties for Compounding list, the DDC, Demonstrable Difficulties for Compounding. That's a mouthful, so DDC. If the FDA agrees, it would make it a lot harder and maybe impossible for compounding pharmacies to keep offering these compounded versions. So why is Novo Nordisk pushing for this? Well, they're saying the compounded versions come with safety risks. Of course, they also want to protect their patent. Everything from quality issues to potential for severe allergic reactions are in their list, and we're going to walk through it this morning. Oh, hello, Barb at Health at Any Cost. Their goal is to limit the use of compounded semaglutide unless stricter controls are in place. So let's walk through that. Here comes Lorraine.
Hey, guys.
Do you want a microphone?
I guess.
Yeah.
I don't have to.
You're just going to have to hold it, babe.
I'll be like that lady who holds the microphone like this and talks.
I didn't have one of those out right now. Hello, everybody. Lorraine's here. You can have, yeah.
Okay. Yep.
Well, I needed the mouse. There you go. Thank you. There's too much detail here. I can't remember all of it. Hello, everybody. Michael Clanton, allowed under shortage to make sema. Well, that remains to be seen, Michael. So let's walk through the story. So the FDA's process and timeline for this, if approved, the petition would make compounded semaglutide illegal. However, this outcome is far from certain. So basically what Novo Nordisk is saying is that these are too difficult to produce and that the FDA should not allow the compounding of it. So there's a lot of science here.
Doesn't seem difficult to me.
Well, you're not a scientist. I'm not a scientist. So let's walk through the process and then I'll kind of tell you what's going on. So here's a quick look at what lies ahead. So number one, there's a public docket and comment period. There'll be a 60 to 90 day window during which stakeholders, patients, healthcare providers, and compounding pharmacies can submit comments. So if need be, we'll let you know and we'll all go make a comment if that's helpful. Given the significant reliance on compounded semaglutide, the comment period may attract substantial public participation, possibly leading to an extension. So there's 60 to 90 days right there just in the process. Number two, they'll have an advisory committee review. The FDA might engage its pharmacy compounding advisory committee to examine the nomination. This review could take several months and is influenced by the issue's complexity and the quality of evidence provided. Number three, the FDA evaluation and rulemaking. So following the advisory committee's review and public input, the FDA will conduct its internal assessment depending on the case's complexity and urgency. This phase could take 6 months to a year. In total, the process will likely take at least a year before a final decision is reached. While this timeline provides some breathing room, it's wise for patients to begin discussing backup plans. So, what's behind Novo Nordisk's concerns? Well, the FDA has approved semaglutide, of course, like Wegovy and Ozempic. And the way it's made with Novo Nordisk, it's using recombinant DNA technology, which ensures a precise controlled product. However, compounded versions rely on synthetic peptides, which introduce impurities. Now, this is all from Novo Nordisk, the scientists over there. I'm sure a couple of you guys know more about this than I do and can debate this. Essentially, the testing found amino acid substitutions, deletions, and chemical modifications, stuff that can make the drug less effective and increase the risk of severe allergic reactions like anaphylaxis. Doesn't sound good. Novo also worries that some compounded products come mixed with unapproved ingredients like BPC 157, which could raise even more safety concerns.
What's BPC 157?
Excellent question. I bet you Cloakster's out there, and he'll tell me. From October 2018 to June 2024, the FDA's adverse event reporting system logged 542 serious events related to compounded semaglutide, including 10 deaths.
Oh my.
Novo Nordisk believes the actual numbers could be higher since compounding pharmacies aren't required to report adverse events like drug manufacturers. There have also been reports of serious dosing errors. In one case, a patient accidentally took 10 times the intended dose and ended up dealing with severe nausea, vomiting, and fatigue for days. I don't have the pens here, but you guys are all familiar with the pens. Obviously, that's a very set amount of dosing. And we have definitely seen people on Facebook and stuff go, I accidentally injected too much. So we'll talk about Novo Nordisk's tack on this. So without the proper tools like the pre-filled pens that come with FDA-approved medications, Novo Nordisk is worried these mistakes are happening too easily. Another concern they've expressed is that compounded versions don't always meet the same quality standards as FDA-approved ones. For example, the compounded oral forms often lack SNAC, the ingredient that helps your body absorb semaglutide in Rybelsus. Without SNAC, the medication might not work at all. They also say there are also risks with storage and handling. FDA-approved versions are designed to protect the medication from light, air, and contamination, but compounded versions often ship in multi-dose vials or preloaded syringes and aren't always as well protected, leading to possible degradation or contamination. So what does this mean for us? It's a completely different tack than what Lilly's doing. Lilly was trying to get off the shortage list so they didn't have to be compounded. Novo's not saying I want to be off the shortage list. Novo is saying these drugs are too complicated to produce safely and you should not allow compounding. So a completely different take on it. Again, not a doctor, lawyer, scientist, pharmacist, any of those things. It feels like a better thought out approach. If I were on the Novo side, I'll tell you there's a lot bringing in deaths and all that.
I wonder if there's been a precedent for other medicines like this, compounded, where they just said, just take them off completely.
Yeah, I don't. Well, there is. This started in 2017, so there's definitely other ones that have been on the list, and we'd have to go back and do the research there. I think the challenge is there's no precedent for compounding at this scale, period.
Mm-hmm.
Right. So there's never been a drug that anybody wanted to do this. Let's see who else we have online. So Tim Crowley, I think one of the issues for Novo and to a lesser extent Eli Lilly is that the U.S. market is one of the few where compounding is allowed to take place. Doesn't happen around Europe where Novo is headquartered. Yeah, absolutely.
And they get it for a lot cheaper.
Brittany says, seems like a fair assessment. Yeah, I mean, it's interesting. You have this European company's take on it and approach, and it definitely feels different than the approach that Lilly's taking. it feels a little, they're talking about deaths and consumer centricity. So is it a still deep concern that it would come off the list and you couldn't get compounded semaglutide? Absolutely. But there's a bit of a humanity to it. I mean, so what does this mean for us if compounded semaglutide makes it onto the DDC list? Pharmacies offering those lower cost alternatives will face very strict regulations. So it remains to be seen how the regulations would roll out. They might be required to make it in the same way that Novo Nordisk is, and that may be well beyond the capacity of most of these. Or they may have to stop offering them altogether. That could limit affordable access to these life-changing medications. So while Novo Nordisk argues this move about safety, it also raises concerns about accessibility. For many people, these compounded drugs are only affordable way to get them, the GLP-1s. Oh, hello, Nadine Shearstone. She says, the first time catching you live. I think it's crazy that one of the things Novo is alleging is that compounded vials are unsafe for consumers to dose. Do they sell insulin vials? It's a good question. And so this is the only thing I'm absolutely positive about all of these GLP-1s and compounding is that there's going to be a lot of lawyers that make money. So anybody that's telling you they know how this is going to work out.
These drugs are worth billions to Eli Lilly and Novo Nordisk. I mean, it's money grab.
So Matt, I'm going to pop you up there and talk to you. Matt, what about actually getting the peptide itself and mixing it yourself? Do you think that is safe? No, I do not think that is safe. At no point should you be using research-grade peptides. You do not know where those came from. They have not been tested. They are not for human use. I get that there's a lot of people out there that are desperate, and we could be in the same place. Hopefully we don't have to be, but we do not encourage you to do that. I don't have anything. We just don't encourage that at all. And I'm sure your doctor would not if they spoke to you as well. So obviously this situation with semaglutide feels a lot like a second gut punch when combined with compounded tirzepatide and the whole crisis going on there. When access to affordable compounded tirzepatide became restricted due to the shortages by Lilly, then the removal of the drug from the FDA shortage list, this left many of us scrambling to figure out what the next steps are and really unable to get the needed doses or forced to pay higher prices. The reality for those of us battling the disease of obesity, having more treatment options isn't just a luxury, it's a necessity. If the FDA moves forward with these new restrictions on compounded semaglutide, we could see the same frustrating scenario play out again with people being priced out of treatments that were finally making a difference in their lives. It's a reminder of just how fragile these medications can be and why we need a healthcare system that offers both safety and affordability. There just has to be a shift in the healthcare system. There has to be more transparency. Coming into voting system, vote for people who are going to give us better healthcare. I'm not going to tell you who to vote for because we don't play that game, but look at them and vote for people who are going to give us better healthcare. Let's see here. Let's see. We have Stacy. That's what is going to happen. People will be desperate and try anything. Yeah, they probably will. Stacy, I got Stacy already. Lynn, so if you guys were just starting out and had a choice of which compounded GLP-1 to use with everything going on, which would you guys choose? Excellent question.
We've only done compounded tirzepatide, Mounjaro, and Zepbound. So for us, it worked great. I think the studies show tirzepatide works slightly better than semaglutide,
but I think
based on availability now, which one would we do? It's hard.
Yeah, I think here's the reality of what's going to happen over the next year. Things are going to change rapidly, and we're all going to have to be in adaptation mode. We're going to have to say things may change. So today, it looks like semaglutide will be available for 9 months to a year at minimum. There's no telling what happens with tirzepatide. It'll be available at least through the end of the year would be my guess. You're just going to have to be willing to say, semaglutide's not available, I'm going to take tirzepatide. That's not available, I'm going to go to branded and take Rybelsus, or we're going to have to do the best we can.
Yeah,
There's not a great answer. We don't know.
I'm just going to keep reordering compounded tirzepatide until I can't. And then when I can't order that, then I'll try to figure out what what to do
Yeah.
next.
So I would just start. People ask all the time, when's the best time to start these medications? I say today. And you know what? If you have to change your treatment plan, you work with your doctor and you do the best you can. Mel Bethel out there, a member. Thank you for the $10 super chat.
Hey, Mel, thanks.
You're awesome, Mel. Super.
Did she put it up there?
Bernie is going to flip his lid. Perhaps the U.S. and Bernie's committee can use this as leverage to lower costs. Let's hope so.
Maybe. I mean, they're on it. They're paying attention, so that's a good thing.
The other option is that if these drugs were added to that government negotiation list, so there's only, I forget the number, 10, 12, something, and the estimate is they're being discussed for that. So that'd be a good thing. Thank you, Mel, though. That's awesome. Matt A, do we have any idea if the cost of Zepbound will increase in the new year to that $650? I'm so nervous. It is so expensive already. I've lost 95 pounds. Good for you, man.
Wow.
Being on Mounjaro and Zepbound and Contrave. So we do not really know. Again, if people tell you they know the answer to things that haven't happened, barring a crystal ball, they don't really know.
I don't think the price is going to go down.
If we follow the precedent, it will probably be $650. Until Lilly can get all their factories up and running and they have more capacity, I don't see them lowering the price. I do think it'll be lowered in the next few years, but it's a supply and demand thing, right? And I know Cloakster and Clark Kent are both out there and they'll leave supply and demand comments. But until they can produce enough that it stays in stock and they can make more money because they want to sell 100,000 doses, not 1,000 doses or whatever the numbers are.
They just can't supply it at this point. I mean, just stay on top of your reorders. Like, make sure you get as many reorders in between now and the end of the year as you can. Make sure you're running down if your medication, you can't find it, make sure you're calling pharmacies. It's kind of a never ending battle for these medications.
Oh, good morning, Donna Joe. So, yeah, we're kind of just doing this thing from Phoenix, Arizona. We've got a conference that's going to start it's 7 o'clock in the morning here in Phoenix.
The next time we go somewhere toward the West Coast, we need more than a day to...
It's a 5-hour flight for us from Charlotte.
The time hour, well, it's a 3-hour time difference from Charlotte to Phoenix. So I woke up at 4:30. That wasn't too bad.
Absolutely. And Pamela, thank you very much. Yes, press the like. Pamela's a member too. I think you're a pretty new member too, Pamela. Absolutely. Please press the like and that'd be awesome. Got 98 people on here right now. So, that's about the news we have today. We'll be reporting back as much. It seems like yesterday it happened while we were in the air. I actually tried to record one on the plane, but the noise was rough. It didn't work.
I looked next to me. He's like talking into his microphone. I'm like, is this going to work? But no such luck. So yeah. All right.
It was too much noise. Like you couldn't hear it. Anyway, so we'll follow this story closely because it could affect many of us on GLP-1 medications, whether it's about safety, costs, or access. The FDA's decisions will have real world consequences. Hello, Big Daddy from Wisconsin. If you found this helpful, please hit the like button, subscribe to the Downsized, ring that bell so you'll know as soon as we post new comments. It helps share this out and more people get to see it. And the bigger we build this GLP-1 community, this GLP-1 army, the more power and influence we have.
Yeah.
So that when the FDA does ask for public comments,
you better believe
we can flood them with 100,000 comments.
You better believe it.
Let's see here. Who do we have? Stacy says, I went ahead to see if my insurance would approve anything just as a backup, and I got approved for Saxenda. I was shocked. So, that's one of the things. We're in insurance season right now, so just make sure talk to your real doctor, your local one. Talk to your telehealth.
All real doctors.
Well, sometimes they're more real than. Sometimes they know you. Right?
Well, it's talk to your doctor. Look at your insurance coverage. Ask questions. Yeah.
So Big Daddy says, I have a year supply. That's a lot. That's thousands of dollars worth of medication. I think.
Would you get?
Yeah, I think my challenge would be.
No.
I don't know that it's going to last that long. And there's not a lot of testing and science to say this medication is going to last this long. So I think Dave Knapp's got a whole video on how to store your long-term stuff, and he's putting like digital thermometers in his refrigerator, and he's storing it in separate locations in case one fridge goes bad. There's that much medication in one place.
I'd be scared of a power outage.
You had a
honestly.
power outage, the hurricane comes through.
Well, hurricane came through and people we knew lost power for 2 weeks. So
And
what do you do
honestly,
then?
I'm not really sure how they're putting year bud dates on things. I don't know what magic they're doing to make them last that long. And the medical theory is essentially that it will not, in all likelihood, and I'm not a doctor, it will hurt you if it's past the date, but it will lose its efficacy. It'll just stop working. So you might, a year from now, end up with a bottle of water. It just,
Well, we don't know. We're not
No,
doctors,
we don't know.
but it just seems. I don't know. I mean, if you've got it now and it's in your fridge, like
yeah, it is
you
what
know,
it is.
don't throw it away.
Yeah, for sure.
But I wouldn't. I don't have more than a
But
couple months out.
No,
so
no,
it's-
2 years worth. I don't. Yeah, I don't think I'd do that. But it says they have 19 months. What kind of magic are they doing on those vials to keep them good for that long? I don't know.
And I don't know how they determine bud dates. Like, what do they?
Theoretically, there's a whole testing procedure, and we
Uh-huh.
could do a video on that, but it's really dry and boring. I don't.
I mean, it just seems random. Some dates I have that are a year out. Some bud dates I get that are 30 days out. Some bud dates 2 months out. Like, it just seems random. So I don't know what makes one bottle of
Well,
compounded
I mean,
Tirzepatide last longer than another.
There's different seals and there's different kinds of bottles, and there's a lot of science that goes into it. A year I don't know about, though, and certainly not past a year. Let's see here. The branded, so Wood Kirky says the branded meds last 2 years from production date. So those are interesting because they're actually, and that's part of the thing that Novo Nordisk talks about. The way those are made, they're made in a complete sterile environment, and it's essentially, like Johnny Carson used to say, hermetically sealed. They're closed in, so there's no possibility of air to get to them whatsoever. If there's a telehealth compounding pharmacy out there that can do that stuff, great. That'd be awesome. I have not seen that to date. Anyway, so let's see here. Let's see. 24 months is that's right, Bill. So yeah, so just pay attention. Hard to say. Elizabeth Varnado lost power here in GA for 15 days. I finished my last pen before the 21 days with refrigerator. So it's that much medication is a lot. So,
Yeah.
but I get it. We all want to stay in stock. We all want to make sure our health keeps going where we want it to go. So I think that's about it for this morning. Maybe we'll be back. Actually, there'll be another video that comes out today that's a downsized dish that Lorraine did. So make sure you catch that later today. And then we will be live on Friday when we get back. Normally we're on Thursdays, but Friday at 7 for a special one. We will be back in Charlotte, North Carolina. So make sure to catch us at 7 Eastern Standard Time then. If you found this helpful, again, please hit the like button, subscribe to the Downsized, ring the bell, the whole 9 yards. I'm Christopher Durham.
I'm Lorraine Durham.
And we are the Downsized. Bye-bye.
I need coffee.